Okay, start.
Hello, this is Dr. Trivedi, a doctor working here today in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Sandra Bullock and I am 35 years.
Okay, how may I address you?
Please call me Sandra.
Okay, Mrs. Sandra, today I'm going to discuss about your health issues. Is that all right?
Okay, doctor.
Okay, and during our discussion, I might take down some notes which will be strictly confidential. Is it okay with you?
Okay, doctor.
Okay, now, Mrs. Sandra, can you please tell me in your own terms what have brought you here today?
Doctor, for last 1 month, I have noticed some rash over my cheeks and I didn't pay attention to it, but it is increasing day by day. And sometimes I feel some burning sensation over the rash. And also I noticed some lumps on my nose and I had acne previously. So I thought that this might be acne again. So I used my acne cream but that didn't help me much. And I wasn't bothered much, but this is increasing. So I visited my GP, and for a long time, I also have some joint pain on my hand joint, and for that, I am taking some painkillers. I told my GP for that, and he thought that I might be something different than acne. So he sent me here.
Okay, I'm going to try to find out what's causing your trouble. You told that this rash started around 1 month back. Has it been present in both sides of the cheek or only one side?
Both sides.
Okay, and did it come along suddenly or gradually?
Initially, it was a small, but it is increasing.
It's increasing. Okay. Can you please tell me that is it flat or raised?
Flat.
Flat. Okay. Can you please tell me about the color of it?
Reddish.
Okay. Is the color same from the very beginning?
No.
Well, what was it at the beginning? The color?
No change in color.
Oh, no changes. Okay, that's all right. And may I ask, do you feel any now?
Sorry, I couldn't hear you.
Any pain?
No pain, some just some burning sensation.
Oh. Recording start. Okay. Okay. And do you feel that you had any pain in the rashes?
No, just some burning sensation.
Okay. And any itching?
No, not like that.
Okay. Have you ever experienced any oozing from these rashes?
No, no.
Okay. And any bleeding coming out?
No.
Okay. And has this increased in size, you think?
Yes, doctor, it is increasing.
Okay. And have you noticed anything that makes it worse?
When I go on sunlight, it becomes worse. I feel burning sensation most at that time, and also it becomes more flashy at that time.
Okay. And anything? What about stress? Have you ever felt that anything making it worse, like stress or anything like that?
No.
Okay. And okay. And may I ask you that do you have any rashes in any other parts of your body?
I had some rash on my mouth, some burning and painful rash over my mouth, but that is not present now.
That is not present. Okay, that's all right. And it was painful. Did it go away on its own?
Yes.
Okay. And well, do you have any rashes in your nose or any other parts?
No.
Okay. And did you had any injury in the recent times? Any cutting or anything like that?
No.
Okay, that's all right. Well, when you scratch your skin or when you just do you do something with your skin like scratching or something like that, do you feel that this type of rash appears there?
No.
Okay, that's all right. And have you felt anything that makes it better, this rash?
No.
Okay. And may I ask you that do you experience any funny color changes in your hand?
No.
Okay. And okay. And may I ask you some questions now? That do you have any headache?
No.
Any changes in your vision?
No.
Any redness in your eyes?
No.
Okay. What about your hair? Have you been experiencing any hair fall?
I think that is a problem.
Okay. For how long?
For last few months.
For last few months. Okay. And you told about your oral soreness. May I ask you that do you have any problem in your swallowing?
No,
Any problem in speech?
no,
Any weakness in any parts of your body?
no.
Okay. And you told about some joint pain. Can you please tell me more about it? Which joints are involved?
Mostly over on the joints of my hands
Mostly on the joints of your hands. For how long have you been experiencing this?
for last few months.
Okay. And can you please tell me that are both hands involved?
Both hands.
Okay. And may I know which part of the hands are involved? Whole hand or fingers or anything like that?
Mainly on the fingers.
Okay. And which part of the fingers? Can you please tell me? The base of the fingers or the tip of the fingers?
All.
All. Okay. And have you noticed any redness or warmth in those fingers?
No.
Okay. And only pain, I think. Is
Yes,
it right?
doctor. Yes.
Okay. And have you felt that anything that makes this pain worse, like any work or taking rest, anything like that?
I think taking rest makes it worse.
Okay. And as you do work, I think it feels better. Am I right?
Yes.
Okay. And what about morning jamming? Have you ever felt any morning jamming?
Yes, doctor. That is around for 30 minutes.
Okay. And then it gradually fades away.
Yes, doctor.
Okay. And have you ever lost any weight? You think any weight loss?
No.
Okay. Any loss of appetite?
No.
Any raised temperature?
No.
Any lumps and bumps anywhere in your body?
No.
Okay. And okay. And any weather preferences?
No. No.
Okay. And may I know what about your water work?
I think it is fine.
Okay. Have you ever noticed any blood in your water work?
No.
And do you ever feel that you have to go more frequently for your water work recently?
No.
Or anything like? Okay. And have you ever felt that? Okay. And may I know about your bowel movement?
I think it is quite fine.
Okay. And I'm sorry to ask, it's a bit personal question, but may I know that how is about your mood recently? Has it been all right?
No, doctor. That is another issue that sometimes I feel so much depressed, and even sometimes I cannot concentrate on my work. I
Okay.
have to wake up at the very morning, but I cannot sleep after that. And I don't know. I have a good family life, and my husband is supporting.
Yeah.
I cannot concentrate on anything.
Yeah. I can get it. I'm very sorry to hear. May I know that have you ever had any fits recently? Any episode of fits, loss of consciousness?
No.
Okay. And have you ever felt that you are seeing something that others are not seeing, or anything
No.
abnormal like that?
No.
Oh, that's all right. May I know some more personal things? I think I'm sorry to ask, but may I know that are you taking any contraceptive pills or anything like that?
Yes, doctor.
Okay. And may I? I'm very sorry. It's a personal question. May I proceed? But it's important for diagnosis. May I proceed?
Okay, doctor.
Okay. May I know that have you ever had any pregnancy loss?
Yes, doctor. 2 times.
2 times. Well, may I know that at which time of your pregnancy did this occur? Did this mishap occur?
One was at 9 weeks, another was at 11 weeks.
Okay. And during that time, where did you seek any medical attention? Why this has happened twice? Any medical attention for that?
Last time I went to the GP, and yes, my job is stressful, so it
Yeah.
might cause this. And also, the second time we were not prepared, so we didn't go for much investigation at that time.
Yes. Okay, I can get it. I can get it. And how about your period? Is that okay now?
Yes, doctor.
Okay. And any chest pain?
No.
Any racing and pacing of your heart?
No.
Any shortness of your breath?
No.
Any cough?
No.
Any chest tightness?
No.
Any noisy chest?
No.
Okay. And may I know that do you suffer from any chronic long-term illness or any disease?
No, doctor. I am quite a fit person.
Okay. And may I ask you some other questions? That have you been on any medication?
No.
Any allergy to any medication ever?
No.
Any hardcore medication or over-the-counter medication?
No.
I'm going to ask a very personal question about medication. Have you ever taken any recreational medication?
No, doctor, never.
Yeah, that's very appreciable. I'm sorry to ask. May I know that do you know anything, any disease condition running in your families, any problem in the glands or anything like that? Any
My
chronic-
mother had rheumatoid arthritis. She
Okay,
also had joint pain on her hands.
okay, I can get it. Okay, and any more history in the family? Any other diseases?
No,
Okay, that's all right. And that's all right. And may I know that what do you do for a living?
I'm an assistant of a solicitor.
Okay, and how is your condition affecting your job life?
Doctor, I had to present at the bar most of the time, and also that is also making something making me shy that I have this rash and I am present all the time.
Yes, I can get it. If you want, we can also involve the social services and occupational health services to for your help. Okay, and may I ask you some personal questions again? Do you smoke?
Yes, doctor.
How many sticks for how long?
About 5 sticks per day for last 10 years.
Okay, actually, smoking can add to your symptoms, and I would like you to try to stop smoking. And if you want, I can refer you to smoking cessation clinic. Is that all right?
Okay, doctor.
And do you drink alcohol?
No, 2 minutes remaining.
Okay, and have you ever been to travel to any other country recently?
No.
Okay, and now I'm going to ask a very personal question. If you allow me, may I proceed?
Okay.
Okay, may I know whom you are living with? Your husband, I guess.
Yes, doctor.
Yes, and actually, that's the personal question. May I ask that have you been involved in any casual relationships?
No.
Okay, that's very I'm sorry, very sorry to ask. Okay, and may I know what your concern is, Mrs. Sandra?
Doctor, one concern is my rash. That is it something serious like skin cancer, and another thing that do I have rheumatoid arthritis like my mother?
Okay, yeah. I can understand your fear. Well, actually, at this moment, it's a bit difficult to be completely sure about your condition. I have to first examine you properly and assess you by making some blood tests and some other scanning tests also, maybe necessary. After that, I can get to you with a far better explanation. But as long as I've taken history, I think that you might be suffering from a condition named SLE along with antiphospholipid syndrome. Don't bother about the term at all. It's actually a condition in which our body tissues can be destroyed by our own cells as well. Okay, and it can involve various parts of the body like skin, at times some blood channels can be get clotted. Okay, and at times some other organs like our kidneys, heart can also get involved. Okay, I'm not totally sure about it at this moment, but I will have to consult with the joint doctor, the skin doctor, and after being completely sure about it, I might get you with a better explanation. But at this moment, and also again at this moment, the symptoms you have with your joints, I think that it's unlikely that you are suffering from rheumatoid arthritis. Okay, are you getting me, Mrs. Sandra? Hello.
Yes, doctor. So what are you going to do now?
Yes, actually, at this moment, hello.
Yes.
Okay, at this moment, I'm going to involve the joint doctor and also the skin doctor, and I'm going to run out the test as quickly as possible so that I can reach a diagnosis and give you. And in the meantime, I will give you some. I will try to give you some some medications for your rash. Okay, and joint pain.
So what is your diagnosis?
Well, I think my diagnosis is SLE associated with for antiphospholipid syndrome.
SLE, that is systemic lupus erythematosus.
Yes, I think it's systemic lupus erythematosus.
Okay. What was the points in favor?
Okay, the points in favor, first of all, the rash pattern, okay, the rash distribution and its photosensitivity, oral ulcer, then alopecia, then I think alopecia, oral ulcer, and also joint pain, which is arthralgia. Arthralgia, and also nervous system involvement manifested by mood changes, and also recurrent pregnancy losses. I think these combine the
I
these
think
are the important
alopecia is not a criteria for,
criteria. Yeah, it's not a criteria for SLA. I recognize. Yes.
and also recurrent fetal loss isn't a criteria. Did you
Yeah,
ask
yeah.
for any rash, rash anywhere in your body except those face, rash over face?
I asked that. Any rash in any other part? She refused.
Okay. So I will investigate.
For investigation, at first I will have to do some baseline investigation, including a CBC, where I will have to look whether she has pancytopenia or not, or whether she has any infective condition by doing ESR-CRP. Then I will have to go for a renal function test, including serum creatinine, and also serum urea and electrolytes, and liver function tests. And very importantly, I will have to do ANA profiling, ANA profiling, and also anti-DS DNA profiling. Anti-DS DNA profiling, and I might also have to do skin biopsy if needed, and skin biopsy. I think these are the important investigations, and also rheumatoid factor and anti-CCP to rule out rheumatoid arthritis since she has joint pain.
How will you manage?
For management, I think I might have to involve a multidisciplinary team, including rheumatologist and dermatologist, I think. And for the skin condition, I might have to go for some local creams, I think, including, and sometimes I might go for hydroxychloroquine as well. I think, I'm not sure. I've forgotten. Okay, and for joint pain, I think I might go for NSAID. I'm not.
For our mood?
Hello.
Anything for our mood?
Yes, I will have to involve the psychiatrist here for the mood.
Okay, fine.
Okay. Hello.
Yes.
Okay, well, I've just forgotten the treatment part actually. Okay, please enlighten me.
Okay, I think we have our best mentor present here.
Okay, sir, you can please tell.
Okay, Dr. Raza,
Hello.
please enlighten us.
Hello.
Yes.
Yes, we can listen.
Yeah, SLE was my last case.
Okay. Okay.
Last year exam case.
Your last case.
Yeah. Last year exam.
Okay.
But what they asked is very typical questions. First thing is, how will you monitor the disease activities? How will you monitor the prognosis? How will you monitor the treatment aspects? These are the three questions first they should be. How will you monitor disease activity?
Okay. Disease activity by looking for the clinical sign improvement, and for biological signs like ESR and anti-DS DNA level.
Clinical signs, which one? What are the things?
What other things?
What are the things which you look at the clinical aspect to say that the patient is improving?
Okay, clinical aspects like improvement of rash, joint pain.
Then
biological, then hematological, like improvement in her blood level, like improvement from anemia, thrombocytopenia. Then
I want you to do only one investigation, which
then
has-
anti-DS-DNA level, anti-DS-DNA level.
is it anti-DNA level or anti-DNS this one or C3C4?
Anti-double strand anti-double strand.
No, is that the anti-double stranded DNS level or C3C4? Which one?
Anti-DS-DNA level,
Sure.
I think.
I also
Yeah,
think that. I think anti-DS DNA. I just read that. I'm not sure. You can enlighten us.
Actually, C3C4 they told.
Okay.
C3C4.
C3C4.
Yeah.
Okay.
So in these patients, you didn't mention about this. Since you're suspecting rheumatoid arthritis, why you're not suspecting this mixed connective tissue disorder?
Yes.
You should have had that investigation. No? Whenever any rheumatology conditions like SLE, rheumatoid arthritis, always add a few more investigations. Okay, like U1 R1B for mixed connective tissue disorders. Did you inquire about this dryness of mouth, dryness of eyes?
No.
Okay. Do you suspect any associated features of SLE like systemic Jogger syndrome, anything like that?
No.
No, it's associated, right? It is it's a mixed country. It's a pattern of mixed connective tissue disorder, and Jogger syndrome is most commonly associated with SLEs, right? So you should suspect. So in case if you suspect Jogger syndrome, what do you do? Would you like to add any investigations, any special investigations?
Yes, anti-Zo antibody.
If she is pregnant, what will you do? If she is not pregnant, what will you do?
Anti-Ro antibody, anti-La antibody.
If she is pregnant.
If she is pregnant.
Yeah. What is the significance?
That is congenital heart block of the baby is associated with anti-Ro.
Okay. Anti-SSA and anti-SSB. These are the two antibodies you should add into the investigation start to rule out this. And would you like to perform any clinical examination to rule out any dryness of our eyes?
Yes, Schirmer test.
Schirmer test. Okay. What is the level which you can say that patient is having dry eyes? Do you have any values?
5 millimeter over 5, less than 5 millimeter over 5 minutes.
Yes, less than 5 millimeter over 5 minutes. If the if tissue paper is less than 5 millimeter dry wet means, then you can say that patient is having keratoconjunctivitis sicca. Okay. This SLE. Okay. What is the treatment management? Did he inquire about this frothy urine and anything?
Yes.
Frothy urine, flank pain?
Yes, he asked.
Okay. Okay. Then how will you proceed further?
Management is actually educating and counseling the patient about her disease condition, then involvement of the multidisciplinary team, rheumatologist, involvement of the rheumatologist, involvement of the dermatologist, and involvement of the psychiatrist.
Okay. Is this condition will get worsened during pregnancy or will get aggravated?
Actually, it usually get better during pregnancy due to some hormone level.
Okay, it's correct. Okay, there are two difference. Multiple sclerosis will get worsened and systemic lupus erythematosus will get better.
Okay.
And then during pregnancy, how do you treat? What are the drugs you will you give? And okay, just tell me about the treatment management. That's what they asked me.
What are the
treatment management? Treatment management. Okay. Apart from this counseling and treatment management.
Okay. For Management, like for acute flare,
Treatment management means treatment management means they are expecting three things. One is investigation, another one is treatment, number three is follow-up.
okay. For investigations, I complete blood count to see anemia and white blood cell count level and thrombocyte level, and then inflammatory markers for ESR is raised and CRP should be normal. After that, renal function test, if there is involvement of the kidney, then serum creatinine should be raised. Then involvement, then a liver function test, then urine for routine examination test for proteinuria or hematuria. And after that, a random blood sugar level and also other routine tests like ECG, chest X-ray, then X-ray of the involved joints, and then skin biopsy. And other
What do you expect in joint X-rays?
joint X-ray should be normal.
Yes, because it's a non-erosive arthritis.
Yes.
Okay, it should be normal. So patient will have only swelling and pain in the joints. They will not have any degenerative findings like osteophytes and all. Okay, they will not have anything. So it should be normal. It's a non-erosive, and there are few things like polyserositis, non-erosive arthritis. These are the conditions. Sometimes they present. Even if you do multiple ultrasound or CT abdomen, you will get only normal studies. Apart from this, kidney changes. Okay, cardiac wise, you can expect only few things. One thing is pericardial effusion and lung wise pleural effusion. And CNS wise, only this mood changes, very organ, no organ changes, only mood changes, psychosis, depression, and all. And then if you come down, eyes involvement, SLE people sometimes they have this conjunctivitis, rarely uveitis, and then sand-like sensation they may feel. And if it is associated with Sjogren's syndrome, they will have this dryness of eyes and dryness of mouth, and the rashes for which is photosensitive in nature, look like butterfly, which across the nose, and then if you come down, if it is associated with systemic sclerosis, they may have this microstomia. If it is associated with Sjogren's syndrome, they may have this dryness of mouth and oral ulcer. That is very important feature. Okay, and if oral ulcer is present, then you have to rule out this one more condition, which is well known for Behcet syndrome. Okay, and because oral ulcer is painful means Behcet's non-painless means SLE. Okay, and then insignificant lymph node enlargement sometimes present, especially cervical regions. Okay, if we come down to the proximal myopathy sometimes present, it may be severe the disease or associated factors like other rheumatological conditions, or it may be secondary to the steroid. Okay, and then if patient is using steroid means, then you have to mention the Cushing or appearance if there anything. Okay, and then if auscultation wise, cardiac wise, it will be usually normal, and lung wise, they won't expect much more examination. Just if you have time, you can demonstrate this story illness. Otherwise, you can leave it. And abdomen is normal, and then that's all. Otherwise, there are no significant findings. If a patient is having joint effusion, we can mention that. Usually in exam we don't have SLEs. The rash won't be there because it is already treated. Okay, so we have to find out other findings, like because oral ulcer sometimes recurrence in nature, so that you have to see. Only few other things we can't see. And did you ask about any pregnancy losses?
Yes. He asked.
Hello.
Yes.
Okay, Monilal, I have one question here. That can you please tell me about the specific treatment of the skin condition, hydroxychloroquine and local Local what? Steroid? I have forgotten. Remember?
Steroid,
Yeah.
tacrolimus, steroid aspirin, like tacrolimus, local cyclosporine.
Yes, local tacrolimus, local cyclosporine. I think hydroxychloroquine, is it important here? I have not, I cannot remember. That's why I'm telling.
Yes. Hydroxychloroquine is also used.
Yeah, local steroid tacrolimus. And for joint pain, NSAID?
For joint pain of, I think hydroxychloroquine will work.
Yes. And okay, and another thing.
Cerebral.
Okay, Dr. Raza is back.
No, just a minute. I'm
Okay.
Yeah. Acipactor. Yeah, cerebral.
মনিলাল,
Yes.
ওকে, দেখো তো আমি কিছু বানিয়েছিলাম আর কি।
Management wise,
Yes.
SLE management, yeah. In treatment aspect, first, apart from this education, counseling, educate the family members and the patient as well as counsel them, and then avoid smoking and alcohol, which may aggravate, and then in this, okay, one more thing. Would you like to give any vaccination to this patient?
Any
Vaccination to these patients?
vaccination, pneumococcal vaccination, and influenza vaccination.
Okay. If suppose patient is undergone transplant, okay.
Any transplant.
Yeah.
Renal transplant?
Yeah. If patient has undergone renal transplant, would you like to give any vaccination for them?
Hepatitis B.
No, lupus nephritis type 4.
You are not supposed to give any vaccination in a transplant patient, especially live vaccinations.
Okay, we cannot give any vaccination.
Yeah, you cannot give. You are not supposed to give.
Okay.
Okay. In this, so before transplant, you can give them.
Before transplant, we can give vaccine, but after transplant, we cannot give any live vaccine.
Yes.
Okay.
And okay.
Treatment. You are talking about treatment.
Follow up with these patients. How will you follow? Yeah. In treatment aspect, in case of any exacerbations, you have to give steroids, and for photosensitive reactions, sunscreen, calamine lotion, and then hydroxychloroquine. Okay. And apart from this, you can use two things for if venal person needs, then you can use immunosuppressants in the form of azathioprine or mycophenolate mofetil. Okay. In case patient is pregnant, you cannot give mycophenolate mofetil. Only azathioprine can be continued throughout the pregnancy. Okay. And for follow-up with regarding patient is having renal illness, then you have to follow up with the patient with the biopsies. Okay. If patient what are the types of, they will ask the types, stages of lupus. Okay. Type 4 is diffuse loop, diffuse, this one, diffuse enrollment of nephritis. And they lost the stages, actually, 5 stages. Definitely they lost. They asked me.
Five
First is,
stages. Yes, I
Type 1
forgot.
is minimal. Yeah, type 1 is minimal. Type 2 is focal. Type 3 is focal plus membranous enrollment. Type 4 is diffuse. Type 5 is end-stage renal disease. Okay. If re-enrollment means, then the immunosuppressant should be continued, either azathioprine or mycophenolate. If it is then put the patient under short list for this renal transplant schedule. Okay, in SLE, and follow up by complement level C3 and C4 level, and ESR and CRP. Okay. And other routine investigations for renal functions like renal function test and the microalbuminuria levels. And apart from this, I haven't faced any questions. They asked me types and how will you treat during pregnancy status, and then they asked me this thing. Pregnancy and during pregnancy, follow-up and treatment without pregnancy, without pregnancy in male patients means how will you treat, female patients how will you treat, during pregnancy how will you treat, and post renal transplant how will you what are the things that vaccination questions. Actually, I answered them. Live vaccines cannot be given, but when will you give this vaccine? I told them just before the surgery.
Okay. So how will you follow up these patients?
That's what C3, C4 level, right? C3, C4 level, urine renal function test with electrolytes and ESR, CRP, and urine microalbuminuria level. If it is worsening, then we have to go for renal biopsy with consent. Okay. If it is stage 4 and above means, then we have to refer the patient for nephrologist and nephrologist and urologist team, and then they will take care of it.
Okay. Anything to add?
Anyone? I don't have anything to add. Tony Apur, do you have anything to add? I don't
This
think.
SLE means APLS. They will APLS. That is very important one. That is one thing. APLS. How will you treat APLS? They asked me one beautiful question: what is lupus anticoagulants?
Okay, lupus anticoagulant.
Yeah, what is lupus anticoagulants?
2 types of lupus anticoagulant.
One is
I forgot.
anticardiolipine, and one more I forgot actually.
Yeah.
Beta 2 microglobulin, I think. Sorry, not beta 2. Anti-beta 2 glycoprotein, I think.
Okay, let's refer it. What is lupus? And that's what I struggled with that question. What is lupus? No, we used to say like measure lupus anticoagulant. Lupus anticoagulants are responsible for this recurrent miscarriage. No? What is lupus anticoagulant? Then I don't know.
Okay, they are very tough.
The very simple question, very simple and basic question. We usually know, we won't give importance to this question. No, lupus and what is lupus? That is in the pathology, pathophysiology, something like that. Will you know? So they asked that simple question: what is lupus anticoagulant? I was looking at them. Like a lupus, systemic lupus, no, that is condition. What is lupus anticoagulant?
It's very difficult to answer in that scenario, I think, because
it depends upon the examiners actually. They will ask only few questions, which we may feel very tough.
Yeah.
Okay, should we stop and proceed for the next?
I think so. I think so.
Okay.